Hi, Dr. Keith Forwith, and today we're going to talk about what to do if you're flying and you have allergy flare-up, sinus congestion, or a cold. Now, the first thing to tell you is that you ought to think about this long before you get here, because once you get here at the airport, if you haven't prepared, there's going to be limited options, but later in the video we're going to look at what can we find here in the airport that can help you. However, if you can remember to do this before you get here, let me give you a few tips that might make the flight, particularly going up and coming back down, easier on the ears. What can you do when you're at home before you get to the airport? Well, about 45 minutes to an hour before you get to the airport, it's a good idea to take a decongestant. Now, decongestants aren't safe if you have blood pressure problems, so make sure that you know your medical history or check with your family physician or your ear, nose, and throat physician before using them. But if you don't have a blood pressure problem, decongestants can work really well, but they have to be absorbed and working before you get on the flight. If you don't have a blood pressure problem, one of the things you might want to think about is getting a decongestant. SUDAFED would be a really good choice. Plain SUDAFED works really well. 60 milligrams is the typical adult dose, and you get that at the pharmacy behind the counter, not over the counter, but behind the counter. You won't need a prescription, but you will need to sign for it, at least here in the state of Kentucky. Second thing you can do is get some AFRIN nasal spray. You're going to want to use that 30 to 45 minutes before you get to the airport, just like the SUDAFED, in order to get the nose decongested and to get those eustachian tubes opened up as much as possible to make that flight easier. If you happen to forget the SUDAFED or forget the AFRIN, or perhaps maybe you have blood pressure problems and you don't want to take the SUDAFED, we're going to take a look here in the airport to see what we can find that might help make that flight go easier for you. Now you might find something here that might help with the pain, but it's really not going to help with your ears, so avoid this. Okay, we're here at the general store. Don't know what we're going to find. We're going to take a look. Hopefully we'll find a few things that might help us. Let's take a look. Okay, here in the medicine section I found some AFRIN nasal spray. This will work well if you forgot to pick it up at home. One thing they have here that will probably help you. Another thing I see on the shelves is a product called EARPLANES. This one's for kids and smaller ears. Here's an adult size. These go into your ear. They make a small seal. They will help, and in a pinch, this is probably one of your better options. Now here they have some DAYQUIL, and this is for cold and flu. It contains an ingredient, phenylephrine. This is not as strong as pseudoephedrine, the ingredient in SUDAFED, but you don't have to sign for it. It's not behind the counter, it's over the counter here, and we can pick it up off the shelf. So if you weren't able to get some pseudoephedrine or SUDAFED at the drugstore, this might make a good option at the last moment. Okay, we're at the counter, and gum chewing really helps. It uses your jaw muscles to massage the eustachian tubes. It can really be helpful. Bottle of water might be helpful also, and I see there's some snacks over there. That might be helpful just for the chewing motion, particularly if you're trying to get kids to get their eustachian tubes to clear as you're going. Having them do some snacks or some gum or even some water would probably help. Hope you have a great flight.